Vacancy, Associate Professor in Mental Health Nursing. We have got various treatment options when it comes to the treatment modalities for the psychiatric disorders. So we use various drugs, we use the therapies, we use the rehabilitative services for dealing with the mental disorders. So the first line of treatment nowadays for the psychiatric illnesses is the use of the psychiatric medications. Yes, so today the topic I'm going to discuss is about the psychopharmacology. So let me give an introduction to the various drugs. What do you understand by the term psychopharmacology? It is nothing but the study of drugs or medications which is used in the field of psychiatry. That is called as psychopharmacology. Now, what is the meaning of these psychiatric medications? The drugs which have got the significant effect on the higher mental functions are termed as the psychoactive medications, or otherwise it is called as psychotropic medications. Moving on to the classification of the psychotropic drugs or the medications, right? So we have got the various classifications which are used for the various psychiatric disorders. So the first classification we have is the antipsychotic group of drugs. We have the antidepressants, the antimanic drugs or the mood stabilizing drugs, anti-anxietal drugs, and the hypnosedative group of drugs. We have got the anticonvulsants, anti-Parkinsonian drugs, and the drugs which are used to treat the alcohol dependence. This is about the classification of the in the future classes. When I deal with each of the classification of medications, we have further subdivisions or the subclassifications, right? So let us move on to certain criteria or what should be an ideal psychotropic medication. So if you take an ideal psychiatric medication, right, so it should fulfill certain criteria or it should have the characteristics. Okay, then we can term it as this particular medication is an ideal psychotropic medications. So for number one, it should cure the underlying pathology of the disorder or the disease. So whatever the disorder, say for example schizophrenia, so in case of schizophrenia, whatever the drug, antipsychotic drug that we administer, it should be having the property to cure the pathology of the diseases or the disorder. So that is the number one criteria of an ideal psychotropic medication. Number two is it should benefit all the patients who are suffering with the same disorder. So we have got many patients who are having the same disorder. Say we have got 10 patients of depression. So when I administer the antidepressant group of drug, it should be helpful for all the patients. So whatever medications I administer, so we can say that it should work on all the patients with the same disorder. The next criteria is it should not have any kind of these side effects, or the drug should not be toxic in the therapeutic dosage. So therapeutic dosage is the dosage that is being given to treat the psychiatric disorder. So when the drug is administered, so the drug should not cause any kind of these side effects and it should not become toxic when it is in the therapeutic range. The next criteria is it should have the rapid onset of action. So the drugs when we give so the drugs that we administer for the psychiatric disorder, yes, it takes time for the drug to act on the client, right? But it doesn't mean that it takes its own long duration to start the onset of action. No. So the drug when we administer, it should have the property of having a rapid onset of the action. The next important criteria is the drug should not cause any kind of a dependence. It should not have any kind of withdrawal symptoms and the tolerance. So there are certain drugs which when we administer, the patient becomes so dependent on it that without the drug he cannot lead his normal life. No. So ideal psychotropic drug should be having a property that it should not cause the dependence. It should not cause the withdrawal symptoms when the drug is, withdrawn or stopped. And it should not cause any kind of a tolerance in the patient. The next criteria is it should not become lethal when the overdose of the drug happens. Yes, at times the psychiatric patients we do not, at times the psychiatric patients we may not know. Okay, there may be chances of over dose of the drug. So in those cases, it should not become a lethal or fatal reaction in the client. So that is another important property. The last property of the drug is the drug, whatever is being given, it should be having a property that it can be administered both in the inpatient department setting as well as the outpatient department setting. So there are many drugs, okay, wherein the patient will be put on for a longer duration of time. Okay, so on the outpatient basis also, the patient can come for a consultation, get the drugs prescribed, and take those pills. So a drug should be having such a property that it can be taken both in the IPD and the OPD setting. So these are the characteristics or properties of an ideal psychotropic medication. Moving on to certain terminologies, right? So we have got some specific terms to understand when the particular psychotropic drugs are being administered. So very important to understand these terms. If you do not know the terms, if you do not know the terms, it becomes difficult to understand how the drug is actually acting when you administer it in the patient. The first term is the efficacy. Efficacy refers to the maximum therapeutic effect that it can achieve when it is administered. So, what is the maximum therapeutic or the treatment purpose of a drug that it can achieve? That term is called as the efficacy. The next term is the potency. What is potency? It is nothing but the amount of the drug which is required to reach that highest potency or the maximum effect or the efficacy. That is termed as the potency of the drug. The next term we have is the half-life. It means the time taken for the drug to get excreted out of the body or the bloodstream. The next term is the agonist. So what is agonist? What is agonist? The drug which will activate the receptor sites are termed as the agonist. The next term is the antagonist. So antagonist is opposite of the agonist. It is nothing but the drugs which will block the receptor sites is termed as the antagonist, which are important to understand when you study the psychopharmacology. The next one is the neurotransmitters. The next term is the neurotransmitters. So what are these neurotransmitters? Neurotransmitters are nothing but the biochemicals which are created or synthesized by the enzymes of the dietary amino acids as well as the precursors. So whatever the diet that an individual takes, through the diet, the amino acids will help in the formation of the neurotransmitters, which are nothing but the biochemicals very much important for the transmission of the nerve impulses. The next term is the receptors. So what are these receptors? These are the molecules which are situated on the cell membrane which act as the binding sites for the neurotransmitters. So whenever the neurotransmitters are released, these neurotransmitters will go and bind on to certain molecules which are termed as the receptors. The next one is the synapse. So what is a synapse? The space between the two neurons is termed as the synapse. So these are a few terminologies which are very important to be understood when you study the psychopharmacology. Next, we will understand how is the normal mechanism of the neurotransmission which is happening. You have seen that one of the major cause for the psychiatric disorder is the imbalance in the biochemicals, right? So what is this imbalance in the biochemicals? Is nothing but imbalance in the neurotransmitter. In some disorders, the neurotransmitters levels would have been increased. In some disorders, there will be a decrease in the neurotransmitters. So why is this happening? Okay, what is the physiology? And these imbalances should be treated by giving the drugs or the psychotropic medication. So when we give the psychotropic medication, so how are these imbalances going to get corrected? So to understand that, you should know the normal physiology of the neurotransmission. So let me tell you the normal physiology of the neurotransmission. So the functional unit of the nervous system is nothing but the neuron, right? So if you take the structure of the neuron, you would have learned that we have got a nucleus, we have got a cell body. Inside the cell body, there are mitochondria, nucleus, okay, cytoplasm, all these things which are there, which extends to a long, axon. So at the terminal part or end part of axon, we have got the dendrites, which will be connected to the next neuron. Right. So this is the structure of the neuron. You can see here in the image, right? So what happens whenever, so this is the structure of the neuron. So how is this neurotransmission happening? For the neurotransmission to happen, the very important thing that has to be there is the neurotransmitter. So as I told you, neurotransmitters are nothing but the biochemicals which are being synthesized by the dietary amino acids and the enzymes. So the dietary amino acid, the enzymes, all these will help in the creation of the neurotransmitter. So these neurotransmitters are stored in the small pouches which are called as the vesicles. So inside these vesicles, there will be the neurotransmitters. So whenever the nerve impulses or the message has to be passed, these vesicles will travel down through the axial potential through the axon. So once it reaches the terminal part of the axon, right? So the neurotransmitters, with the help of the minerals, for example, the calcium, it will evoke the release of the neurotransmitter. So very important, another thing is the calcium, which will help in the evoking the release of these neurotransmitters. So get released from the presynaptic neuron into the space called as synapse. From the synapse, the neurotransmitter has to attach to the molecules which are present on the postsynaptic neuron. These molecules are nothing but the binding sites, which is the receptors. So the receptors are the ones which will receive, or the neurotransmitter will go and get attached to these receptor sites. After getting attached to the receptor sites, the neurotransmission or the potential or the message is being passed. Some of the neurotransmitters will be remaining in the synapse. Some neurotransmitters will be reuptaken by the presynaptic neurons. And some of the neurotransmitters, okay, and the vesicles, okay, the empty vesicles without the neurotransmitters will be sent back to the presynaptic neuron. So this is the normal mechanism which is happening. So why there is a problem in this neurotransmission? So when there is a problem in the neurotransmission, there may be an imbalance in the neurotransmitter which is going to cause a psychiatric disorder. So one thing, it can be the synthesis of the neurotransmitter itself may not happen because there may be poor dietary intake of the amino acids, wherein the synthesis of the neurotransmitters may not happen. That can be one reason why there is a decreased neurotransmitter. The second reason is once the neurotransmission, Once the neurotransmitter reaches the end terminal part of the presynaptic neuron, there may be insufficient calcium to evoke the release of the neurotransmitter. That can be another problem. The third problem can be is there may be more release of the neurotransmitter into the synapse. The fourth reason, it can be that the neurotransmitter is not getting binded or not getting attached to the receptor site. The next can be a problem with the receptor site. There may be very less receptor sites for the attachment of the neurotransmitters, or there may be poor reuptake of the neurotransmitters. So these are all the areas where there may be an issue with the neurotransmission, because of which there be alteration or imbalance in the neurotransmitters, which can lead to the psychiatric disorders. So to correct this imbalance or alteration, we are administering the group of drugs which are the psychotropic medications. When the patient is put on the psychotropic medications, there are various changes which happens in the neurotransmission level. So let us see the effect of the drug on the neurotransmitters. Number one is the release. More neurotransmitters are released into the synapse from the vesicles of the presynaptic cells, right? So when there is a problem with the decreased neurotransmitters in the synapse, the second one is the blockage. So what happens here? Already there is a lot of neurotransmitters which is attached to the postsynaptic neurons, right? So we can say that there is an increase in the neurotransmitters in the patient. So what happens to avoid this increase or to treat this increased level? We'll be giving drugs which will block the attachment of the neurotransmitters to the postsynaptic receptors. So those drugs are, effect is called as the blockage. So another effect is the receptor sensitivity changes. So what happens again here when there is an increase in the level of the neurotransmitters? Okay, to treat that, the receptor sites will be given certain drugs. We'll be administering certain drugs to decrease the effect or bring about the changes to more or less reduce the sensitivity of these receptor sites. Thereby, the attachment of the neurotransmitter may not happen. When there is a deficiency of the neurotransmitters, okay, we'll be administering certain drugs which will enhance the prolongation of action of the neurotransmitter. So those groups of drugs are nothing but blocking the reuptake. Okay, the reuptake of the neurotransmitter will be blocked. So what happens? There will be more time for the neurotransmitters to remain in the synapse. So the reuptake of the neurotransmitter will be blocked. So that effect is called as blocked reuptake of the neurons, which will enhance the prolongation of the action of the neurons, which will enhance the prolongation of action of the neurotransmitters. So another important effect is interference with the storage vesicles. Okay, so vesicles are the small pouches inside which there will be the neurotransmitters. So these vesicles, from these vesicles, the neurotransmitters can be released more or it can be released less. So that is the interference which happens at the level of the vesicles. The next effect is the precursor chain interference. So what happens when there is a lot of neurotransmitters which is synthesized, or there is a less amount of neurotransmitters which is synthesized, right? That is termed as precursor chain influence. So if there is a decreased level of neurotransmitter, the creation or the synthesis of the neurotransmitters itself is not happening. The group of drugs that we give to improve the synthesis of the neurotransmitters. So there are certain drugs which will decrease the synthesis of neurotransmitters, because there are a lot of neurotransmitters leading to increased level of the neurotransmitters. So these are the various effects that we can see when the psychotropic medications are administered in the patient. So let us see certain guidelines when we are administering the medication. So nurses are the important personals who are there 24/7 with the patients, who are responsible for administration of the psychotropic medications to the client. Yes, so certain very important things that we have to keep in mind. So these are the guidelines which will help the nurse, when she is administering the medications. Number one is the nurse should not administer any kind of the medications without the doctor's written, medication. The nurses should not administer any of the psychiatric medications without the doctor's written order. So any psychiatric medications that a nurse should administer should cross-check with the prescription or with the written order. And also, if you have any kind of a doubt, you're not able to understand the writings, you're having any clarifications, always you have to cross check with the psychiatrist and then only can administer the medication. The next responsibility is all the medications that you administer to the client should be charted on the medication chart. So whatever the drugs that you have administered should be mentioned that it is given, so that it will act as a communication to the staff of the next shift. She will understand what are these medications which is administered, and also it will enable the nurse also to have accountability of the administration of the drug. The third thing is, when you are administering the medication, see to it that you address the client by his name and also ascertain his identification. There may be many patients with the same disorders, there may be many patients with the same name, right? So you need to always address the client with his name and also cross-check for his identification, so that you may not administer the drug to a wrong patient. Do not leave the patient unless and until the drug is swallowed. So especially these psychiatric clients, what they do is they just take the medications, they may just throw it here and there, or they act that they have swallowed the medications. No, make sure that the drug is being swallowed under the supervision of the nurse. Do not allow the patient to go to the bathroom to take the medication. So very, very important. The psychiatric clients, they may not listen to you, but see to it that you do not allow the patient to go to the bathroom, not only to the bathroom, to other areas, unless and until he swallows the medication under your supervision. Do not allow one patient to carry medication to another patient. Okay, there are times wherein the patients may just request that, see, not well, can you send the medications with another client? So never ever do that. Don't give the medications to the client. So never allow the patient to give the medication to another client. So at times there are situations wherein you would have forgotten to take the water, or the client would have forgotten to get his water bottle. So so in those scenarios, do not leave the medication tray on the patient's bed and just go to fetch the water. No. So always carry the medication tray with you. The next important thing is, you should not force the patient to take the oral medications because of the risk of aspiration, especially in case of stuporous patient. Okay, so stuporous schizophrenia, catatonic stuporous schizophrenia. So in those cases, do not force the patient to swallow the medications, because it can result in the aspirations. Later on, it can be later on it can lead to fatality. The another important responsibility is, you have to check the drugs daily for the change in the color, the change in the odor, and the number of the medication. So you may not know, how the changes of the drugs can happen. Check for the expiry date, check for the odor, check for the color, and the number of the medications. So if you take the psychiatric medication, so in the psychiatric ward, each patient will have his own, bottle or the box. Okay, so always label the box and close the lid of the particular bottle very tightly, and have a label with the patient's name, the diagnosis, as well as the medications which are there in the particular bottle with the frequency. Okay, so that it will be easier for administering the medications, and also it will ensure the safety of the client. When you do the labeling should be bold letters, and it should be clearly labeled. The poison drug should be labeled legibly and should be kept in the separate cupboard. So these are important medications which will be administered at certain times. So see to it that these medications are labeled, legibly, and they are kept out of reach in the separate cupboard. Make sure that there is an adequate stock available of the drug supply, and also ensure that you don't overstock the drug. Make sure that the patient has no access to the drug cupboard. Always keep the drug cupboard locked. Always keep the drug cupboard locked. Okay, and do not allow the patient to open the cupboard for you, and don't allow any other workers to go near the medication cupboard. So these are some of the responsibilities or guidelines we can say for the nurse when she is administering psychiatric medications. So this is a brief, introduction to the psychopharmacology. What are the classifications, or what are the normal mechanism which is happening at the neurotransmitter level, and when the drug is administered, what are the how it is going to have an effect. So that is all about today's topic. Hope you all have understood. Thank you.